Hello and welcome to a benefits education open enrollment session for Adventure Tours, Ventures by Dawn. My name is Philip Shetson, and with me today are Milagros Biggs and Amy Tarazona. We are all members of Bona Vita Benefits Group, a boutique benefits brokerage and consulting firm who's been working very closely with Michelle, Foster, and Terrence to help navigate the complexity of benefits in today's ecosystem. Now, it brings me no pleasure to say this, but health insurance costs have increased year over year by more than double digits. And so it's really important for you all to understand the value that Adventure Tours brings to you all by making a benefits plan available. Now, that being said, you might be asking yourself, why are we going through a second open enrollment? Didn't we do this already in January? And the answer is yes, you did. But with the exception of the fact that health insurance prices typically do not finalize until open enrollment is wrapped up. So I want to give everyone a good understanding for what happened in January and to explain where we are today and make sense of it all. Adventure Tours went out and procured quotes in the market to provide their employees with benefits that were beyond what they had with Kaiser, with UnitedHealthcare, that allowed employees from various states, whether it was New York or Pennsylvania or North Carolina or Tennessee, the ability to access a richer network of providers, hospitals, radiology facilities, so on and so forth. The quotes that were provided by UnitedHealthcare were preliminary, and they were subject to change based on the final open enrollment numbers. So what happened was education happened. I believe Kelly Benefits may have been a part of that discussion. You all went through the open enrollment process to make decisions around your benefits. And then come at the very end of January, just as the benefits went live on February 1st, UnitedHealthcare adjusted the prices of the health insurance by 30%. And that is typical when you don't have a strong understanding of the group's risk and you're not exactly sure who's going to participate in the benefits and who is not. Most people live in a world where they believe health insurance it should be universal. And I'm a firm believer that that is a basic benefit that we should all be entitled to. But the insurance companies have to compete and continue to keep up with the cost of the healthcare ecosystem, which goes up annually anywhere from 8 to 12%. And so because the United States healthcare ecosystem continues to increase in cost, professionals, doctors get paid more, nurses get paid more, the cost of equipment goes up, the cost of labs go up, the cost of medications go up. In turn, insurance costs go up. And insurance costs are entirely driven by the community of people who are insured in a particular company. So when Michelle and Terrence and Adnan had experienced this increase, they worked tirelessly to evaluate the marketplace to figure out where can we possibly find a solution that's going to be more cost effective than the 30% increase that UnitedHealthcare had provided us. And they went to Aetna, and they went to Blue Cross, and they went to Cigna, and they went to the associations, two of them, to evaluate the plans. And it just so happened to be that none of the carriers were able to provide a price for the health insurance that made more sense than what UnitedHealthcare even had adjusted. So, why am I discussing all this? Because that brings us to where we are today, where we are given an opportunity with UnitedHealthcare to reassess what medical programs are being offered, reassess what decisions we've made as employees who are participating in the program, to identify what the best course of action is for everyone involved, effective April 1st moving forward. So, if you've been insured, you should be listening to this call. You are being given a special enrollment window in the middle of your plan year to make elections and changes. For those who might be listening in and talking to other employees, if you did not initially elect to participate in the benefits on February 1st, this is not an open enrollment window for you. And the only way that you'd be able to be eligible to enroll in the plan is if you have a qualifying life event, which is typically loss of credible coverage elsewhere, birth of a child, marriage, divorce, and a few other avenues that you can entertain. So today, Philip Shetson, I'm the president of Bona Vita Benefits Group, and it's going to be my job to help bridge the gap in making sure you're all educated on your options and that you all feel comfortable landing softly into the available solutions that are being provided to you all today. Michelle Foster should have passed around a memo alluding to what happened in this entire 60-day window while we were working tirelessly to figure out how to go about the next steps. And she should have also shared, if she hasn't yet, a benefits guidebook, which goes through the benefits page by page, makes insurance, in my opinion, much easier to understand. What's a preventative care coverage? What is a deductible? What's a copay? What's a coinsurance? We're going to review that today in our call. With me, as I mentioned, is Amy Tarazona. She's a dedicated employee benefit specialist that is ready for your phone calls, for your questions, for your emails to ensure that you have access to professionals who are licensed and insured and have spent decades working in this industry to help support you all to navigating this decision and then beyond. If you have issues in June or May because you don't have a drug that's being covered and you want us to figure out what's going on your behalf, you don't have to call a 1-800 line and sit on the wait with the insurance carrier. You can reach out directly to our team. And so we've established a email for you to do that, and we'll talk about that a little bit later today. So let's jump into what we're going to be discussing today. As far as medical insurance, that is the only line of benefit that is going through an open enrollment adjustment. If you've enrolled in the dental and the vision, you do not have to worry about making any changes to those. Those benefits are staying exactly as they are today. You will have access to 3 health insurance plans. Originally, you had access to 5. We've narrowed it down to the 3 that made the most sense for the employees. And we based that decision on where a bulk of the employees were currently receiving their benefits, meaning where were a bulk of the employees insured today, and why would we keep the 3 plans that we did? We'll walk you through that. As far as the transition timeline, very important if you're listening in that you understand that we have a very tight timeline to make this all work, and we are all going to work diligently. Michelle, she's our last chain in the command, and we are going to work and make sure that everyone who has made an election today is aware of these changes and that they know what their options are moving forward. If you're listening into this call, I want to be clear that this is considered a passive open enrollment, which means that technically you don't have to make any changes if you don't want, but you do need to be aware of the adjustments in cost because of that 30% increase that UnitedHealthcare passed along. I want us to be clear that today we're going to do a deeper dive in benefits than what you may have received in the initial open enrollment session, and I want you to stick with me through that. We need anyone who is making a change to make that change no later than March 30th. You might be asking, why is there such a tight turnaround on this? Well, because Michelle and the team in payroll need to know what changes need to be made for participants as they get their checks deducted for the benefits that they're enrolled in. And that needs to happen no later than really March 31st, April 1st, the latest, so that everything is in line for that very next pay period. I believe you're all paid on Monday. So that first Monday in April is where you're going to see the new deductions take effect. Any decisions that you make on the benefits, whether you're staying the same course, you're making adjustments, everything will take effect April 1st. So if you're not changing anything, great news, you get to continue to use your insurance cards as is. If you are choosing to make a change, if you're going from one plan to another, you will get a new ID card. You will have a new member ID number most likely, and you will need to know that anything that you've done from February 1st to March 31st is behind you, and you're using a new insurance card on April 1st moving forward. So what's our agenda for today's meeting? Well, first and foremost, we need to get you familiar with the open enrollment portal. It's very easy to walk yourselves through it, and our team is on standby waiting to coach you through this. So if you have questions or if you're having issues accessing the system, don't hesitate to reach out to Amy or Millie on today's call. You'll have their information at the end of the slot, at the end of this presentation. You can reach out to them and say, hey, I'm having trouble making a decision. Here's what I want to do, and we can do that for you. Effective Tuesday, you're going to start getting calls if you've not made a decision. We want to do our best to make sure we put this in front of absolutely everybody and that they understand that effective April 1st, some of these changes are occurring. We're going to review the benefits offering. We're also going to talk about the enrollment portal and what benefits advocacy means to Bona Vita Benefits Group and what you guys have access to by way of that. So firstly, you all should have received an email from Employee Navigator. It will say something to the tune of Adventure Towards Employee Benefit Management or Adventure Towards Benefit Management. You're going to look for that email. They're going to require that you agree to their use and privacy policy. Don't worry, we're not using your information for anything other than getting it to the carrier so that you have everything you need. You're going to continue to the portal in step 3, and you're going to see a page that looks something like what you see in step 4. You're going to see a green button that says start. You're going to click that button. If for some reason you need it in another language like Spanish, you can toggle the menu down and change the language if that's an easier way for you to learn about your benefits. We've uploaded all of your personal information, so none of this should be manual. You should see your first name, your last name, your gender, your social, your dates of birth, your home addresses. So do me a favor in step 6, just make sure you're confirming that all of this data is accurate. Really important that if you've moved in the last week or 2 weeks and payroll systems don't even reflect it, that you make sure we're updated on that because that's where they're going to send your insurance card. That's important. As far as step 7, you'll have the opportunity to consider adding dependents. Now, a number of you, apologies, there's a train that's going by. A number of you have chosen not to insure yourself with any dependents, but there are a few that have considered it. So in the event you want to double check that your dependents are listed, this will be the area where you can add a dependent to evaluate enrolling them in the plan, or if you can confirm that the dependent you originally added to the plan is listed there. Step 8 will allow you to evaluate your coverage. Now, what's unique about step 8 is it's actually going to show you what your costs are going to become in the event that you want to stay with the same plan. So if you're currently on plan EDP 5, for instance, it'll show what your new plan cost would be under EDP 5, and it'll show you the 3 other programs that are available to select from, whether it be EDP 5, whether it be ERGH, or whether it be the Surest plan. Yes, we have gotten familiar with your plans in such detail that we have them all memorized by heart. So please be sure to also understand that these deductions are reflective of the per paycheck deduction. So in this case, you are going to see the amount that comes out of your check on a weekly basis, the way most of you are paid. Step 10, we skipped step 9 here. Step 10 is to review and sign the agreement that we are making changes or we are staying the course. Again, remember what I said earlier. This is a passive open enrollment. So you technically don't need to make any changes, but you will see your costs change on April 1st. So this is your chance to make elections that both serve your families and your individual healthcare needs, as well as your needs financially. So let's go into the healthcare ecosystem. I think first and foremost, I want to make it as easy to understand and recognize some of these terms. So we're going to cover this in detail. There are typically 4 areas of the healthcare ecosystem. There are preventative care services. These are things like your annual physical, your pap smear if you're a female going to the OBGYN, birth control, prostate exams, colorectal screenings, colonoscopies, immunizations, vaccinations. These general, treatments or what these general visits are, they're there to prevent diseases. They're not there to diagnose diseases. So when you think of preventative, think I'm healthy, everything's fine, but I'd like to go make sure that nothing has popped up, right? Now, if, for instance, you were to go to a doctor and say, I'm not feeling well, but can I also treat this as my preventative visit? They're going to say no, because they can't submit a claim for a preventative visit and a diagnostic visit. That brings us to the second area of healthcare ecosystem, minor diagnostic or minor corrective. Think of this like I'm sick, I need to see a specialist, I might need to go to an urgent care, maybe I have to go to the emergency room because I'm not sure an urgent care can take care of what's happened. And these areas are typically lower on the cost spectrum of the healthcare ecosystem. It doesn't require, expensive radiology equipment, it doesn't require an anesthesiologist, it doesn't require that you're overnight in a hospital as an inpatient, individual. So in this case, typically, most of these costs are covered under a copay. Some scenarios they're not, but we'll talk about that later. Then there's major diagnostic and major corrective. Think surgery, hospitalization, anesthesia, radiology. These typically fall at the crossroads of highly paid professionals and highly costing equipment to provide you the treatment that you need. And these typically require that a portion of the cost is borne by you, the individual insured, before the insurance carrier starts paying. That's known as a deductible, and we'll cover that in a minute. The last area of healthcare is medications, what we call RX or prescriptions. Now, it's really important to know that with prescriptions, there are generic drugs, which are really inexpensive, and they're typically compounds to the original formulas that were created, right? Medication is created and brought to market. Typically 12 to 15 years is how long a pharmacy company or pharmaceutical company can keep it private before then they release it to the generic world where they can make compounds of it. Preferred brand drugs are drugs that are branded, but there's a preferred relationship between the manufacturer and the pharmacy. And non-preferred brand and what we call specialty pharmacy, these typically are more expensive drugs. And it's not surprising to say that these drugs might cost $1,000 a month to fill, not to you, but to the insurance company, up to $20,000 a month to fill. Don't worry, you guys will never be paying that much of a cost for your medications. So let's dive in. What is a deductible? A deductible is the amount of money you have to spend before the insurance carrier says that they're going to start contributing towards costs. Preventative care typically never applies, right? And I say typically because there are certain situations where you might get caught in one of the cracks of the healthcare system. We'll talk about that. Minor diagnostic, minor corrective, deductibles don't typically apply, and medications, deductibles don't typically apply. What you're going to find the deductible applies towards is major diagnostic, major corrective surgery. Think hospitalizations, surgeries, anesthesiologists, radiology services. Once you've met your deductible for the year, you don't have to continue to fulfill it. With car insurance, the deductible is per occurrence, right? But with healthcare, it's an accumulating number. So once you've met your deductible for the year, you're done meeting the deductible for the remainder of the 12 months. The out-of-pocket maximum alludes to the most amount of money you're going to spend before the insurance carrier covers everything. So if you have a $5,000 maximum out-of-pocket, once you spend that on your healthcare throughout the 12-month period, then you're done paying for medications, co-pays, co-insurances, and all of that. That protects you. Some people have health insurance because they want to pursue services on a regular basis. Some people say, I want to have insurance to protect me in a catastrophic event. I know I've seen online what people post as their medical bills for staying at a hospital for a week. I don't want to be responsible for a $40,000 bill. In that situation, right, it's really important that you understand that everyone has a different reason to be insured. Some people are navigating their illnesses and want to be treated for them. Some people are saying, I just need the protection in the event of a catastrophe. Some people have a little bit of both happening, right? That's what insurance is there for. 16%, believe it or not, of bankruptcies in the United States are as a result of medical bills. And that's not like a baloney statistic. You can look it up. It'll be anywhere between 15 to 18%. That's a wild number. So what is coinsurance then? Coinsurance is a split between you and the carrier. It's typically represented as a percentage. So if you have an 80% coinsurance, that means the carrier is paying 80% of the bill and you're paying 20% of the bill. Typically, coinsurance applies after a deductible has been met, and we're going to talk a little bit about that once we look at the plans. As far as more common words that we've probably been familiar with over the years, co-payments. Co-payments are flat costs at the time of service. Now, typically, co-payments apply for things like a doctor's visit when you're sick, or a specialist visit, or an urgent care, or an emergency room, or might apply to medications. Co-payments typically do not apply to major diagnostic or corrective procedures because the deductible has to apply before then there's a co-insurance split. Now, you might be saying, Phil, there's a lot here. I don't really understand insurance. Can you just tell me what it means to be insured? Sure. Thank you for asking. In this case, if I were to go see a doctor and I didn't have insurance, the doctor has the ability to charge me whatever they want. If they want to charge me $300, that's what they charge me. $100, that's what they want to charge me. $1,000, that's their prerogative. I don't have insurance. I pay cash to that doctor. What insurance does is they say before the doctor can give you a bill for what you have to pay them, it must be sent to the insurance company to review the bill, to reduce any waste, or to reduce the cost. So in essence, if I were to be sick and need to see a doctor and they perform a few tests and they want to bill me $300, if I show them the UnitedHealthcare card and they take UnitedHealthcare as an in-network provider, they can't ask me to pay $300. They have to send the claim to UnitedHealthcare. UnitedHealthcare might reduce it to $200, and then they'll say, here, Phil, is what your responsibility is of the $200. If it's a copay, maybe I just pay $30 for that visit, and the insurance carrier sends the other $170, right? That's called adjudication, and that's why insurance is important. I would say less impactful for doctors' visits and urgent cares, although urgent cares can be really expensive. Really impactful when you talk about hospitals billing you $70,000 or $80,000 for a 3 or 4 day stay, right? Primary care doctors are doctors that exist at the entry point of the healthcare ecosystem, internists, general practitioners, family doctors. And these doctors are able to do your annual physicals, treat minor conditions like strep throat or flu or taking a COVID test, right? Some doctors have the ability to perform chest x-rays. It just depends on what the doctor's office looks like, right? You do not need a primary care doctor for any of your plans, right? These are not HMO programs, health maintenance organizations, they're EPO programs. And that means that you don't need to appoint a primary care doctor to go see a specialist. You're free to see any doctor you want so long that as they accept the insurance carrier and the contract. Specialists are doctors that specialize in a particular area of medicine. Think cardiologist, endocrinologist, rheumatologist, ear, nose, and throat doctors, or otolaryngologists. I can't say that one. And these doctors specialize in an area of medicine, and they are typically the doctors that can perform procedures on you in the confines of their office. So I'm going to give an example. Let's just say you're going for your skin check with your dermatologist, and they find a skin tag they don't like. Well, if you have certain plans, you might pay a $30 or $60 copay for that visit, right? Because that's what you pay at the time when you get there. They go into the room, they check your skin, they say, Phil, I don't like this skin tag you have on your shoulder. I'd like to remove it and biopsy it to make sure it's not cancer. Great, doc, please. I don't want to know that I have cancer or not know about it, right? They'll take a scalpel out, they'll apply a local numbing agent, they'll remove the skin tag, send it into the pathology lab. You walk out saying, all I paid was $60. This is great. Well, you paid $60 for the specialist's time, but what they did was surgery. And surgery might be a different area of your benefits program subject to a deductible. So it's very, very common to be in a situation where you work with a specialist, not realize it, and receive a bill after you've paid a copay. Again, this is not the health insurance company trying to get one on you or the healthcare ecosystem failing. It's the fact that so many people are misinformed of how the healthcare ecosystem works. And it's important to realize that our jobs are to educate you in advance. So as far as the carrier, again, remember, we're going to save all questions until the very end. As far as the carrier, we're going to stick with UnitedHealthcare. As far as evaluating everything in the marketplace, we told you we went to Blue Cross Blue Shield, Care First in Maryland, which is Blue Cross in other states. We went to Cigna, we went to Aetna. Even if they were to provide us comparable or cost-effective pricing, you have to weigh out the situation where you're used to UnitedHealthcare because that's what you've had for 2 months, but now we have to switch to another carrier. That's a bit disruptive. So what we felt as a team would make the most sense was to be able to keep UnitedHealthcare, and at the end of the day, that's what made the most sense. These benefit programs offer only in-network benefits. So it's really important that when you call your doctor's office, you provide them with your group ID number, your member ID number, so that they can confirm that they are in-network with UnitedHealthcare. UnitedHealthcare has a lot of networks. In this case, you have a choice of a choice network or a choice plus network, and we're going to cover that in a few slides. Let's jump into the plan details. So when we were originally enrolling in our plans, we had access to 5 plans. I think we had the Surest, the ERGH, the EDP5, the EDTD, and one other program as well. In terms of what we wanted to do is we wanted to narrow down the offering to what we believed would be the most impactful solutions for the individuals. And what I want everyone to do is to take a moment to reflect on what kind of healthcare user you are, because that's what's going to dictate whether you go to the Surest plan, whether you go to ERGH, or whether you go to EDP5. Let's talk about the deductible. So with the Surest plan, there is a 0 deductible, which means that the insurance carrier is immediately supporting the cost of your claims right off the bat. There's no deductible for you as an individual, which is the first number you see here, and there's no deductible for you as a family either. There are no out-of-network benefits, so just please keep in mind that you have to work within the network to find your treatments and your care. There is a pretty high out-of-pocket maximum of $9,000 for the individual and $18,000 for the family. But assuming that you are a mild to moderate user of healthcare, you don't anticipate any hospitalizations, you don't have any surgeries, you don't need to be put under, you're just typically going to a doctor, a specialist, a physical therapist, maybe a mental health counselor, you use a couple of medications here and there. This is a great solution because there's no deductible, and everything is structured as a copay, and we'll show you what that looks like in a few slides. The coinsurance is 100%, which means that there's no question of once I've met the deductible, which in this case is 0, am I responsible for 20% of the remaining bill, 30% of the remaining bill? What Surest is doing is incredible. It's giving you the power to direct your care and identify the cost of that care in advance of pursuing it. It's really unique because in the healthcare ecosystem, it's shrouded in uncertainty, right? I go to a specialist and I pay $60 and I get a bill for $400. Why? Well, it's because you did surgery and you weren't aware of it. So what you're able to do with the Surest plan is you're able to identify the cost of what you're pursuing in advance of pursuing the service, which is, really it's transformational to individuals who might be sick or want to see a specialist or go to an urgent care. ERGH is a plan that has a $3,400 individual deductible, a $6,800 family deductible, and a max out of pocket of $6,000 individual, $12,000 family. Once the deductible is met, typically services are covered at 100%, which means there's no share of cost on your end. What's unique about ERGH as a plan is the fact that it is a high deductible health plan. Preventative care is covered completely free of cost, but minor diagnostic, minor corrective, and medications require that you meet that deductible of $3,400 before anything is covered. You might say, why would I want to choose that when I have the Surest plan that's a little bit more cost effective than that plan? Well, typically you only choose ERGH if you want to set up a health savings account outside of your company, where you want to put money away on a pre-tax basis, and that money can be used to pay for health, dental, vision, prescription costs, and that money accrues and accumulates. It's like an IRA, right? But prior to the age of 59 and a half, you can use that money tax-free to pay for your care. And then after the age of 65, you can use it like any other retirement account you might have. The EDP5 plan has a $2,000 individual deductible, $4,000 family, and has an out-of-pocket maximum of $5,000 and $10,000 respectively. Once you've met your deductible of $2,000 or $4,000 if you're a family, then everything is covered at 100%, which means, again, no cost sharing exists. I believe there's one exception to that rule, and it might be radiology, and we'll talk a little bit about that on the next slide. Let's take a step further. Important to note that these plans are listed in terms of cost, with the Surest plan being the most cost-effective plan you can select from, and the EDP5 plan being the most costly plan that you would select from. What you'll see with the Surest plan is that the primary care doctor visit can be anywhere between $25 and $130. Why is that important? Because it's important to note that it's up to you to determine where to go get your services. So we put the power in the individual's hands to look at an app to evaluate, if I'm sick and I'm not feeling well, do I go to a doctor that's 3 blocks away from me or 5 blocks away from me and save myself $40 or $50 in a copay? Applies to every aspect: a specialist visit, physical therapy, radiology, urgent care, emergency room, hospitalization. Yes, that's right. Like if you need an MRI and you were to need an MRI, it might cost $500 or $600 on the ERG plan or the EDP5 plan, but on the Surest plan, it might be $200 or $300 because you're navigating the network of care providers and you're choosing the care provider that aligns from a cost perspective to your goals. Medications, tier 1 are generics, tier 2 are preferred brand, and tier 3 is non-preferred brand. They will never exceed $20, $90, or $150. So again, just be mindful that it's a great program. It allows you to identify your cost, and we're going to look at a demo of the website shortly after this slide. ERGH says that the deductible has to be applied to everything. Nothing is covered. Primary care visits for sick visits, specialist visits, physical therapy, radiology, urgent care, emergency room, hospitalization, and medications all require a $3,400 deductible be met before anything is covered. Now, if I go to my primary care doctor for an annual physical, that's free. If I go to my OBGYN, which is a specialist for an annual pap smear, that's free. Right? If I go for a colonoscopy, typically that's free. If I go for a prostate exam with a proctologist, that's free. But anything that's there to diagnose a condition and treat an illness, that is not free, and the deductible must be met first. EDP5 plan functions more like your traditional insurance plan that maybe a lot of you are familiar with. You have copays that are the same for any doctor you see that takes the network. So a doctor's visit is $30 for doctor 1, 2, 3, 4, 5, all the way to doctor 300, right? So long as they take the UnitedHealthcare network. Specialist copay is $60, physical therapy is $30, urgent care $75, emergency room $400. Now you might say, well, what happens if I get hospitalized? What happens if I need to surgery, right? Well, then the deductible of $2,000 applies, and once that's been met, then the insurance company covers 100% of the bill. Right? With exception of radiology, which is typically 20% your responsibility, 80% the responsibility of the insurance carrier. So again, as I'm thinking about this, and you're going to see this a little bit later on here, right? If I am somebody who typically is not a big user of healthcare, then the Surest plan is going to be a clear winner, both in the cost, and we'll see that in a few slides, as well as the ability to navigate the network to find the cost of care that most aligns with what I want to spend. If I'm somebody who wants to set up a high deductible or an HSA to put money away on a pre-tax basis to pay for my health care and to be able to accrue that over time like an IRA, the ERGH plan would make sense. If you're someone who's more typically inclined to have a policy that functions normally the way you're used to maybe other policies functioning, then the EDP5 plan will make the most sense. So before we move forward, I wanted to go ahead and start a video. Let's just quickly watch how the Surest plan works, and then I'm going to do a live demo on the next slide.
Say to the health, speak where they are, or the doctor's office, with information they can use to decide how to get care. Say hello to Surest. Let me show you how it works. Simply type in what you're searching for. In this case,
Sorry guys, 1 second, we had a glitch. Can you guys still hear me?
Yes.
Sorry guys, 1 second, something's going on with our screens. Just 1 second, apologies for that. I don't know what just happened. You guys can still see my screen?
Yes.
Yes.
and you can narrow your search. Like, and it's treatment option, like virtual visit, medical office visit, and more. In this case, we'll pick a medical office visit. You'll see a map and a choice of providers. Scroll down and see more providers, or scroll up and zoom in on the map to see providers near you with copays clearly marked. Click into that and get the details you need to review your provider choice, location information, copay, and what's included in your visit. Scheduling information is just a click away. The Surest plan is designed to engage members by giving them tools they need to find providers, treatment options, costs, and more. Members can find opportunities to save. And since Surest uses a UnitedHealthcare network of doctors, clinics, and hospitals, one of the largest in the country, there are plenty of options to choose from. Say hello to a health plan that's redefining what's possible. Surest. See how powerful, simple can be.
Excellent. So I hope that what that representative presented to you all was an understanding for how the plan works. And now what I wanted to do was show you how easy it is. So I'm going to use my cell phone very quickly, and I'll share my screen in a second, to just make you all aware of just how easy it is. So give me 1 second. And it should register. Sorry, guys. Having another glitch here. All right, so I'm going to share my screen here on my cell phone, and it'll show you exactly how easy this is. Share my screen. All right, let me know once this comes into view. All right, great. So this is me live doing this for you all, so you understand. You can very simply have taken a picture of that QR code, click continue here at the bottom, identify what the plan details are, which we've shared, 0 deductible, no coinsurance, out-of-pocket maximum of $9,000, click continue, and then see that the cost of certain services are represented by a low cost and a high cost. You could check all the prices, but then it allows you to talk about specific conditions. And again, it allows us to check up prices. So if I were to be in the situation where I wanted to specifically find doctors, I could look for a particular condition. So if I were to be in New Jersey, which is where I'm at, and I wanted to find a physical therapist in New Jersey, I would say find provider for physical therapist. This is showing us in Baltimore, so let's zoom down into Baltimore here. And we can see that I can actually go to ATI Physical Therapy, I can go to Horn Chiropractic Center, ATI Physical Therapy Pasadena, MedStar Health Physical Therapy, and there's different costs for different services. Just like that video showed you, if I wanted to click and see what can I do at ATI Physical Therapy, I know that they're about 7.2 miles away from the business's main address, zip code, and I can locate the contact information and go ahead and book an appointment very easily. So again, the point of Surest here in this situation is to make sure you guys are aware that the power of pursuing your healthcare is at your fingertips. And with it being the most cost-effective plan, there's no incentive for us to tell you to go that route, but it is a really great alternative. So for those that are interested in playing around with the Surest system, go ahead and take a picture of that QR code and it'll bring you directly into the live website that you're able to navigate benefits. So let's talk about the payroll. So where we were originally with the people who are enrolled is you can see the original open enrollment costs. To make it easy for you all to understand this, you can see these costs as a per paycheck deduction. So if you were insured on the Surest plan, your initial cost of enrollment was $52.18 per pay period. EE stands for employee only, ES stands for employee spouse, EC stands for employee child, and EF stands for employee and family, which is another adult and a child on your plan. So for those that chose the EDTD plan, you were paying $91.70 per paycheck. EDP5, it was $73.50, ERGH, it was $55, and Surest, it was $52.18. Based on the increases, this is where the costs were going. EDTD, if we were choosing to keep the plan, would have gone up to $136.35. EDP5 is going to 112, ERGH is going to 83.54, and Surest is going to $77.79. I can't stress this enough to say that if you have a zero deductible health plan like the one that Surest offers you and it only costs you $77 per pay period, that's an incredible value that I don't want you all to overlook. So what we had decided to do was we had decided to remove the EDTD plan and make it so that other plan offerings were available. We did this by negotiating a little bit of a concession directly from UnitedHealthcare. And in this scenario, which you can see is the Surest plan is $74.78. So if I were on EDP5 or EDTD, it's really not that major of a change, right? To go from $73.50 to $74.78 or from $91.70 to $74.78, it actually is a savings. People who are on the Surest plan, yes, there is an uptick in cost by about $22 per paycheck, but it's still an incredible value for those that need to make sure that they're protected in the event that they have catastrophic illnesses, or they want to be able to navigate the network to make decisions for how they pursue care in the most cost-effective way. So as I mentioned, if you want a predictable cost with no deductible as you pursue your healthcare, you should consider the Surest plan. No deductible, copay-based visits, lower monthly cost than some of the other programs. If you want a traditional copay plan, which allows you to access any doctor who takes UnitedHealthcare, then I would strongly encourage you look at the EDP5 plan. If you want a plan that provides you the opportunity to put money into a health savings account, then the ERGH plan would make the most sense for you. Again, EDTD is no longer going to be offered because of how dramatic of a cost increase that people were facing. So all of this to say that the company has spent a lot of time and energy. Michelle and Terrence have done everything to turn over every possible stone to continue to offer benefits that were valuable to the organization. Don't hesitate to look at this, right? Give yourself a chance over the weekend, tomorrow, Monday even, to evaluate your benefits. Think about what you've learned today, which you may not have learned initially in your education sessions, to understand how the Surest program might benefit those that are looking at paying more or looking to save as much money in their paychecks as possible. Get enrolled. Don't hesitate to reach out either. Millie, myself, and Michelle is has set up a benefits@abdttours.com email that links directly to our team, and it's going to be very easy to email that email and have access directly to the parties that are going to be supporting your knowledge base, your education, and your navigation of your healthcare benefits. Lastly, don't forget to maximize your programs, right? And I say this because as the healthcare costs have increased, right, year over year, what has also happened effective January 1st of this year is that the federal subsidies that were supporting the individual marketplaces have all dried up. So we've worked with companies across all of the states, and we've seen anywhere from 100% cost differentials to 400% cost differentials in the individual marketplace. People were paying $100 or $400 or $300 a month for their health benefits, and they've gone up to $400, $800, $1,200, $1,800. It's really invaluable to have access to benefits through your employer, and we want to make sure you learn how to maximize them. So with that, I wanted to thank you all for your time and attendance and your energy, albeit I know everyone's on mute here, but really mostly for your attention here, right? Because this is a very important aspect of your overall compensation package, and we want to make sure that you are well educated. So again, the deadline is the 30th. Please don't hesitate to make elections. Jump into our portal to make those decisions, and don't hesitate to reach out because we want to be here to support you guys through this process. Again, on behalf of Bona Vita Benefits Group, Philip Shetson, Milagros Biggs, Amy Tarazona, we want to thank you for your partnership, and we look forward to supporting you all.